Welcome to our mental health fireside chat. I'm Becky Edwards, and I'm running for the U.S. Senate. I am thrilled to be joined tonight by the director of NAMI Utah, Benee Larsen, and Taryn Aiken, founding member of our Utah chapter of the American Foundation of Suicide Prevention. Especially meaningful to me tonight, as I am a social worker and former marriage and family therapist. And so these issues are really important to me professionally as a member of our community. And I'm really excited to have Benee and Taryn to have you here this evening. Could you both take a minute to just introduce yourselves? Benee, why don't we start with you?
Hey, happy to be here. My name's Benee Larsen. I work at NAMI Utah, which is the National Alliance on Mental Illness. I am the prevention director. I'm over suicide prevention. I oversee a grant from the state of Utah for suicide prevention. And as part of that grant, I co-chair the Utah Suicide Prevention Coalition. And that coalition has like six or seven work groups associated with that. And one of the groups that I get to co-chair is the faith work group, which is my favorite group that I get to work with different faith leaders from across the state. So I am really grateful to be here to have this conversation. I'll turn the time over to Taryn.
Thank you.
Yeah, hi everyone, Taryn Aiken, and I serve as the area director for the Utah and Nevada chapters, excuse me, of the American Foundation for Suicide Prevention. I get to work with Benee very closely, and she is not only a dear friend, but a great colleague to get to be in this fight with. I came to the work years ago after we lost our dad to suicide, and just through my own personal, journey in mental health and substance use recovery, have found a passion for giving back and helping others, and grateful that I came across AFSP when I did. Helped to charter our Utah chapter, and just been doing this for coming up on 20 years, which is amazing. So really appreciate the time you're given tonight to discuss, mental health and what we need to do and do better in Utah.
Thank you so much for being here. I'd love to give both of you the opportunity to ask some questions about how we can improve how we address mental illness on a federal level. But first, I have a few questions for you. Let's start off with the most obvious. What is the state of mental health in Utah? How are we doing?
Do you want me to go first, Benee, and then I'll throw it to you?
We both come from different kind of organizations, and NAMI, our focus is very much on mental health, mental illness, and support for families and individuals with mental illness. And we offer support groups that are free of charge and classes to educate families who are struggling with a mental health condition themselves or with a family member. And we know that there are not enough resources here in Utah and nationwide. We know that there is, the need, especially, I know we know this past year, it has even increased. Those needs have increased, and we don't have mental health care professionals to meet that need. And so there is definitely an opportunity to increase our mental health care here in Utah, because we know that this past year and a half has given us this opportunity that we've talked about our mental health more. It's normalized it. It's made it not so stigmatizing to have anxiety or depression, because I think we all have had an opportunity to be in someone's shoes who may experience depression on a regular basis or experience anxiety, uncertainty. And so, the hope moving forward is we can take this normalizing of mental health and move it forward so that people aren't ashamed of asking for help, or they don't hesitate to reach out for help and support.
Yeah, that's so true. Taryn, what's your experience here? And, Benee mentioned the impact of COVID. How has that changed what the landscape looks like for mental health here in Utah now?
Yeah, before COVID, it was interesting. The Ken Gardner Institute came out with a study that ranked Utah as dead last in again, folks who are living with a mental health condition and then access to care. And about 25% of our population, pre-COVID lived with some form of a mental health condition here in the state of Utah. And we just, again, do not have enough providers to meet that need. COVID only exacerbated that. While we did not see increase in suicide death and overdose deaths during COVID, we did see an increase in people reaching out in distress and help seeking. And so, as Benee mentioned, we've really worked hard for the years that I've known her, in really changing the landscape that says, hey, it's okay to seek help, and mental health conditions are treatable, and we all have mental health. So let's talk about it. Let's seek that help and support. But what we're continuing to run into now is we're encouraging folks to get that help and support, but they're waiting, right, to get into a provider, waiting to get in to be seen. And so that's where we really need to shift our focus and change again. How do we increase capacity for people to be able to access services when they need it?
Yeah, that's a really important thing. Of course, reducing stigma is incredibly important. And as that has improved, what other roadblocks, you mentioned capacity, but what are your most significant roadblocks that you've seen for people in need here in the state in terms of accessing mental health services? What still needs work?
It's interesting. As part of the Utah Suicide Prevention Coalition, there is specific work groups, and one of the work groups is a community engagement work group. And we've really focused this year on helping people figure out how to access mental health care, because it's a pretty daunting process. You have to, if you have insurance, you have to find provider, and then you have to find a provider that's accepting new patients, and then you have to call those providers to find out if they're accepting new patients. I love sharing the story when my own daughter we were trying to find a new therapist for her, and I had a list that was this long that were providers in my network, and I had to call each one of them to see if they were taking new patients. And it took me till I got about 3/4 of the way down the list to find one person who was accepting new patients and was willing to see my daughter within, a 3 to 6 week period of time. That was 5 or 6 years ago, and I know that has only increased. The demand and the process is hard. And so we really like to acknowledge that it's a difficult, challenging struggle. But we're trying. We've made some ways on our Live on Utah website to help people kind of navigate that and say, what are the steps? Because we know that after about 3 phone calls, people usually give up. That's about all they can handle. And if they're already struggling with a mental health condition, 3 phone calls is not going to last very long.
Yeah, that's a significant barrier. Can you talk just a little bit about what some of those resources or those steps are that you just referred to?
Yeah, I actually think I one of the first things you do is you figure out what you're looking for. What are your issues? What do you need help with? And then gather referrals. Maybe ask friends or call your insurance and find out who is well respected or who is on your insurance, and start there. And often it's really good to get a friend or a support system to help you. Like maybe sit there with you and make some phone calls with you, or somebody who's been through it before. That's a really great way to have kind of a support. NAMI Utah has a mentor line that is people on the other end of the phone who have a mental health condition or have a family member, and they will walk you through that process of who to call, what to do, and that just having a really kind, loving, supportive person on the other end of the phone to help you is amazing. They're some of the kindest people I know. But those are some of the great ideas of things that individuals can do on their own, or to help be a support to a friend or family member who want to take that step to get help but just don't know how to do it.
Yeah. And of course, reaching out to NAMI is a good recommendation as well. Yeah, thanks. Taryn, roadblocks that you see.
Well, going back to what Benee mentioned is it's that getting into treatment, right? Or accessing somebody who can support you. So yeah, you go through that process of calling your insurance if you have it, but then what are you going to pay? We continue to see denial of coverage and parity laws not being enforced in the state of Utah, where they're limiting the coverage that families are able to get for their mental health, or just flat out not paying it or covering it all. I've worked with so many families, again, even in my own family this last year, we had an experience with my nephew where, to get him the care he truly needed and deserved would have been out of pocket $40,000 to $50,000. And the fact that we're forcing families to choose between helping their loved one and getting them the help that they need and deserve, or going broke, is just cruel. And so we really need to move towards ensuring that our insurance companies are, again, compliant with federal parity laws and strengthening that here in our state. So that they don't have as many opt-outs, or, again, that they're covering the service the same way they would if it was a physical injury. And we still have an issue there.
We would never expect someone to forego, taking care of other needs of their family, putting food on the table so they could afford something dealing with a physical condition, would we? We wouldn't stand for that. But it's par for the course in many families' lives for mental health. And it's incredibly hard to hear when those stories happen. And you're absolutely right. The parity laws exist, and let's enforce and let's make sure that we're complying with what those laws are to help people. All right. Any ideas? Last question. Any ideas you have about improving access? So now you mentioned we need more people in the pipeline. How do we encourage that? Get more folks prepared to be in those helping professions, because there's a wide range of folks who can be of real assistance to people who are in crisis, or even just sort of maintenance, mental health. Where's our best opportunity to increase the number of people who can be in that position?
So, and when we need something, we need it now, right? It's really hard to say, well, we need more psychiatrists and we need more social workers and LCSWs, but we can't snap our fingers and have them appear. Taryn and I have been in conversations a lot lately about the opportunity we have for peer support. Like, we have peer support specialists that can be trained pretty quickly, who have that lived experience, that can help give that support when there's that time in between seeing maybe a therapist or getting into a psychiatrist. So those are things that if we could fund and pay for them, in a living wage, that we would have opportunities to quickly have some support that way. Peer support specialists do amazing work because they get it. They know what somebody's going through. And then, as we look, farther down the road, we do need to treat our healthcare workers like we treat, other professionals, and pay them accordingly. I know that many go into the field and they don't last for very long because it's hard work. Yeah. And it doesn't pay terribly well. And so, or they go to elsewhere within the community, but those at-point services for individuals are missing those people. I know that, you can do support groups and other things that provide help and resources for other individuals. But I know that there is that definite need of immediate relief, that we could do something with peer-based.
Yeah, so even after the immediate need, the crisis is sort of abated, that maintenance and kind of long-term care, those are resources that could be developed. Absolutely. Taryn, anything to add there?
Oh, so much. Just echo what Benee said, but again, like maybe we look into doing more, it's been explored before, loan forgiveness, right? Or something to help people that would motivate them to take up this field. But it absolutely comes down to the, folks right now who have at least a bachelor degree or could be a psych tech. They make $13 to $17 an hour, and that's not livable in today's world. And so if we could get better reimbursement from insurance that could then allow these treatment facilities and hospitals to pay their folks better, they would sustain. We had several units, in hospitals, our state hospital and local mental health crisis that are looking at having to close because they just don't have the staffing. And so that's an easy fix. And, we could afford to do better there. And then I just would add, I would love to see mental health take, the same, again, seriousness that we do with our physical health, that we have better diagnostic treatment to help understand what's going on in a person's brain. Mental health is one of the few fields that psychiatrists don't look often at the organ they treat. And that needs to change. We need to have a better understanding about what is going on in the whole person, but really looking at the organ that we're trying to treat, not just treating symptoms. And really giving people, information and tools that can really help to improve their mental wellness as they move forward.
And, you talked about brain scans, but certainly that is an assessment tool that helps round out the total picture of, it's not a sole diagnostic, but it is something that helps round out the whole picture of someone's wellness and can be really an important thing. Thanks for bringing that up. Well, I'm going to give you a chance to turn the tables here for a minute and ask me a few questions. Who wants to go first? Taryn, let's start with you.
All right.
or honestly, just even discussion.
Again, I've mentioned a lot of the needs that I see and what I would love to see happen, at a federal level and a state level too. But it starts at the federal level that, again, we ensure that we're holding people accountable for the laws that already exist. Parity first and foremost. Nothing disheartens me more than to watch families, again, substance use. This is a huge one. Substance use disorder is destroying so many families. And yet again, that treatment is rarely covered by insurance. And we know it to be something that a lot of people with a coexisting mental health condition struggle with. And so I just would love to see more of a focus on how do we create, again, that system that says we are going to treat this the same, we are going to fund it the same. There's, care and options for folks. Like you mentioned, we would never forego something that's physical. I don't show up to an emergency room having a heart attack and get turned away, well, maybe now because our emergency rooms are full with COVID, but in days past that didn't happen. And yet we have people who show up who are in a mental health crisis and are told to wait, months and months and months to get support. And so we need to find a workaround now. So I'd love any thoughts that you have or ways that we could, work on that.
I echo both your comments on the importance of looking at mental health on parity with physical health. And it's so important. Part of that, it ends up helping dispel stigma. And part of that actually, one of the things that we can do is we can use existing touch points that people have with the medical community. So we know, for instance, postpartum depression is something that impacts a lot of women, and they're already coming in for their well baby visits at 1 month, 3 months, 6 months, et cetera. Let's integrate mental health checks at the same time that people are already having physical touch points in their other medical conditions. And I think we're seeing some of that. As that becomes more of a natural discussion, just part of the conversation you have with your medical professional, I think we get more a holistic picture about how the total person is doing, because so many physical conditions actually do have and are impacted by mental health, stress, depression. They do impact you physically. And so it's the best possible thing for us as individuals and as families of those who are suffering from mental illness is to see them in totality. And so using existing touch points, using other innovations around mental health and behavioral health as well. The telehealth, I think, has been a good move in the right direction. And in fact, when I served in the Utah House before in 2017, we ran this bill that was a pilot program for telehealth that was focused on mental health. And at the time, I think there was some concern would this be a modality that would be impactful? Could someone actually receive benefit to conversations with someone in a Zoom like we're having right now? And there was some concern about the viability of that as a treatment type. And as it turns out, it's been incredibly beneficial for people, especially in our rural communities who don't have access to all of the specialties and the other paraprofessionals around mental health. It's been really a useful thing. So there are innovations, there's technology, there are ways to expand touch points, and even as we educate people in our schools. And we're seeing this more and more, people talking, using conversational terms around wellness, talking to kids in schools. How are you feeling? Identifying feelings, emotions. How do you deal with those when you're feeling those in, of course, age appropriate ways? But I think gathering skill sets that are helpful and can be grown through the rest of our years. And then absolutely holding insurance companies to the high standard that they are required to have when we have parity laws in place. And we need to make sure that they're held to those standards.
Agreed. I love that. I would love to kind of do a follow-up to that, Becky.
Yeah.
If, I'm curious, in our conversation tonight, we've really talked a lot about the need for mental health care professionals, or to broaden the opportunities that are out there. What would be your solution, or do you have, a better idea or thought as to how we can move forward and kind of closing the gap for those needs? You mentioned telehealth. I think COVID, one of those other little silver linings of COVID, that it shows that it works and that we can do it.
Mm-hmm.
If we can make sure insurance companies are going to pay for those services the same way they would pay for an in-person visit. I know that has been discussed as an ongoing problem, to get insurance companies on board again with paying telehealth the same way you would pay for an in-office visit.
Yes, good point. Good point.
I know, both of my children all three of my children have had therapy appointments this past year via telehealth. And awesome, wonderful, and I don't know how they would have survived this year without that opportunity. So what a great blessing that is. And to have that to continue moving forward would be wonderful.
Absolutely. And I think, so telehealth is an example of something that didn't exist a few years ago, to the same extent that it does today. And there are innovations around and good things happening in every state. We're seeing some good things in Utah. The suicide hotline is an example of that, and some other things, the Safe UT app. And other states can learn from what we're doing here in Utah. I think it's exciting to see, states be these laboratories for innovations and how things can be done better, and we can learn from each other. I always want to look at the funding streams that are coming from the federal government and make sure that they're actually going to where the needs are the greatest. Are they effective? When those parity laws were passed in the 90s and then again in 2008, how we looked at mental health was so different then than how we look at it today, and how our treatment modalities were different. Our belief systems, stigma certainly was a lot higher then, and our understanding of suicidality, et cetera. We're much further down the road with our understanding, with both identifying and treating mental and behavioral health issues now than we were in 2008 and even in the 90s when the first parity law. Let's make sure that our standards of requiring and adhering to those parity laws mirrors where we are today with our innovations and treatment modalities. And I think that's something that has kind of lagged behind. And I think as much as we're in a position where we're looking at ways we can continue to meet people's needs, we also need to sort of bring into the 2021 the expectations for our insurance companies to literally cover these services in the very same way. And in the end of the day, this ends up being something that makes sense for not just the individual who is suffering, but for their families and actually for the insurance company. This makes sense for them in the long run to treat. And this includes prevention, this includes supportive services ongoing, as well as the crisis services, but it's in their best interest as well. And I think part of these are conversations that bringing people together and helping all parties understand the ways we can work together to really meet the needs of individuals who in many cases are our most vulnerable and our most at crisis people in our state.
Yes.
Yeah, it is incredibly important especially as we also look at payment schedules. So one of you, maybe Benee, you mentioned payment schedules for telehealth compared to in-person treatments. And that's something we need to look at as well. And I think it just is this entire issue is something that we need to have a vigilant eye on. We need to have an understanding, because I can guarantee you there's no family in Utah that has not been affected in a really personal way by mental and behavioral health challenges. And we can do better by each other. There's so many wonderful community efforts around supports for families and individuals who are experiencing these challenges. But for government funding, for programs, let's make sure that the money that's already allocated is actually meeting our needs in the way that can be the best supports to individuals and families, and that we have standards in place for those conversations to, like the brain scans, like you mentioned, Taryn, that we make sure that all of the information that would be needed to give us a complete picture of individuals in crisis and going forward is at the fingertips of the people, so we get the best treatment possible. And I think that to me is really the crux of the issue. It's removing that stigma and just continuing to work to make sure that mental and behavioral health receives the very same focus, the same attention, and our same commitment to health as we give our physical health. And I applaud the work that both of you do on behalf of your organizations. You're doing incredibly important work for individuals and families in our state, and I appreciate it so much. Before we go, one final question, and I just want to make sure for listeners who are here, and this is a question for you too. If someone is in a mental health crisis today, how can they get help? Where do they turn? And if someone knows someone who's in a mental health crisis, how can they direct their loved one to get help? Let's hear both of you give an answer there. This is a kind of educational opportunity for those listeners who are here and might be thinking, I am in that position. I would like to reach out, or I have someone I love who's in need.
Yeah, I mean, I'll just start. I think the first thing is that you have that real conversation. You know, if it's you that's struggling, find that person that you can be honest with and just tell it like it is. And if you have to tell a few people before somebody really listens and takes, then do that. And if you're the family member, love your person and just thank them for opening up and letting you know. And again, I'll let Benee talk specifically, because I really wish more people would utilize NAMI, but I don't think enough of us know about it. NAMI has tremendous resources. But, you know, you can always call the warm line at the University of Utah, now Huntsman as well. You can always reach out to the Suicide Prevention Lifeline if you have somebody who's in immediate crisis, and at least talk with somebody about what the next step should be or could be. But the real thing that we each need to do is just have that willingness to, again, have a real conversation about what's happening, show love and compassion, and then again, encourage our person to reach out and get that needed help and support.
Thank you. Benee?
Yeah, So I kind of ditto everything Taryn just said. If you've got an individual that is in crisis, always make sure that they're safe. We always want to make sure we don't leave someone alone who is in crisis, in immediate crisis. And we call the crisis line the 1-800-273-TALK. But if you're a family member or you yourself are struggling and you just need that little bit of extra help and support, if you go to NAMIUtah.org, we have classes and support groups that are free to anyone, that can help educate you on your mental illness or on your family member's mental illness. It helps give resources, and you get that support of others who have lived that experience to help you walk it and help you through it. But also, like I said before, our NAMI mentors are available free of charge Monday through Friday. You can call our NAMI numbers. Let's see, 801-323-9000. I'm used to working from home. I don't call it very often anymore. But I am just so incredibly blessed to work at a place with people who their whole purpose is to help people and get people the help that they need, because it is out there, and just making people aware where to turn and where to find that help. And sometimes just having that little bit of hope is all that you need to get through the day or to get to the next place. Providing hope is really how we prevent suicide and how we save lives. And so just be that for somebody else.
Yeah.
Be that hope that somebody else needs.
And for people to realize things can be better. Help is there. Hope is on its way, and we can, as a community, as a state, and as people who are deeply involved in this issue, I appreciate what you do. Thank you for giving those resources. Thanks for joining me here tonight. And we'll put a link to both of your organizations on our site. And again, thank you so much.
Thank you.
Yes,
Okay.
thanks, Becky. It was so nice to meet you and be here tonight.
You as well. Thank you. Bye-bye.
Bye.
Bye, everyone.